The broadcast is now starting. All attendees are in listen-only mode.
Everyone, and welcome to our webinar. I am KT Waxman, and I am the Director of the Masters in Healthcare Simulation program at the University of San Francisco. And I will be co-presenting with Genevieve Charbonneau, who is the manager of the USF Simulation Center. So you'll be hearing from both of us today. I'm very excited that Genevieve is able to participate with me today and share her work in our lab. So it looks to me like we have some of you on the line that have already been accepted to our program. So I welcome you, and I'm very excited that you've signed on today. We will talk a little bit more about the program at the end of the webinar. And what we'd like to do is do about a webinar every month and just kind of give you a taste of things from educational frameworks to creating a business plan to running a lab. And today's is really on the operational aspects of running a lab. So we're going to talk about the purpose of simulation labs, the day-to-day operations of a lab, which is staffing, scheduling, testing, ordering supplies, and maintenance of equipment. We're going to talk about layout, and I'm sure that Genevieve will talk to you about our lab and what we would have done differently had we had the means to do that. She'll let you know that we are so busy that we've already outgrown our space. So there's some best practice models out there that we'll talk about in terms of layout. And then we'll talk about the purpose. How are our labs being used? Is it clinical orientation, skills practice classes? Is it testing? Are we using standardized patients, high fidelity? What is the purpose of our lab, and how do we manage that? So we want to provide you with best practice models to understand the components of running a sim lab or program. And I say program because often there is no lab. You may be in a hospital setting where there's no actual place, and all of the simulation is done in situ. So what that means is you have to have a program and a strategy and templates and policies and procedures, but you might not have an actual lab. Essential elements such as curriculum development, financial and project management, space, and flow will be discussed. So I always like to talk about what is simulation at the beginning, because some of the people on the line may be brand new to simulation and just sort of exploring this wonderful industry. It is defined by the Society for Simulation in Healthcare as the imitation or representation of one act or system by another. And simulation has really grown over the last 10 to 15 years. We used to focus on the technology of simulation. It was very exciting, all of our new simulators, and now we're really focused on the pedagogy of simulation and creating processes and creating templates and standardizing the way we do simulation. There are really 4 purposes of doing simulation. This is also according to the Society for Simulation in Healthcare. The first is education, and education could be students, could be staff, it could be your community. Assessment, to assess the skills of those learners, research, and what's really big right now is health systems integration, using simulation in large healthcare systems to help manage the flow of the hospital and the operations, to test new systems, to actually use a simulator to be admitted as a patient and walk them through an entire admission cycle to test out the system and see where their gaps are. There are hospitals in Arizona and other areas, but Arizona comes to mind, that actually has a simulated hospital, and they put all of their new employees through simulation in this hospital that they've converted to a training center before they actually go in and touch patients or equipment. There are multiple types of simulation, and Genevieve will talk about the types that we have in our lab at USF. and the ones that she would like to buy and integrate. But really, these are just a handful, according to the Society of Simulation in Healthcare and ANACSL, which is the International Nursing Association of Clinical Simulation and Learning. Computer-based simulation is very common. We've been doing it for a long time. Think about gaming. Think about looking at a computer and working with avatars to complete some tasks before you go into simulation. So computer-based simulation is very popular, especially with the millennials, and they can do some of this work before they come into the clinical arena or the lab. Then there's high fidelity and low fidelity, and high fidelity is typically your high fidelity simulator that can breathe and have bowel sounds, breath sounds, pulses, can talk, etc. But high fidelity also could be in using a standardized patient that is actually a real patient. So fidelity really equals realism. But typically you'll hear high fidelity as it equates to one of the very expensive simulators. Low fidelity could be a mannequin that doesn't necessarily have bowel sounds or pulses, but it might breathe, it might talk, or you might have to make it talk by using a device that you pick up at Radio Shack and put a speaker in the room and create the sense that it's talking, but it really isn't. And there's a very large use for low fidelity simulators, especially when people are on budgets, especially when you write a simulator and you realize that you don't need high fidelity to complete your tasks or achieve your outcomes. So an example of low fidelity might be to have a couple of Recessa Annies, a very low level mannequin, and then one high fidelity mannequin, and have the students take care of 4 patients and create scenarios where one might be calling for a pain med, the other might have a family member that's irritating, and the other in the high fidelity room is declining significantly and deteriorating. And how does that student or staff or learner manage those 4 patients? Another type is standardized participants, and I've changed the name from standardized patient to standardized participant, but they are used interchangeably. There's a whole movement out there to increase the number of standardized participants for training, especially in the family nurse practitioner world. And at USF, we actually have an FNP program, and they use standardized patients for assessment prior to them going into a clinic situation. Standardized participants are also family members, or they used to be called confederates, that would go into the room and be actors. They're actually actors, and that's another word for them, is an SP. A hybrid simulation would be a combination of some sort of simulator or test trainer and a person, and an example of that is an OB simulation where the top half of the simulation is a woman in labor speaking, breathing, asking for things, and the bottom half is a OB prompt test trainer where the baby is actually in that coming out. So the woman is talking, and the half of it is a hybrid with a simulator. Immersive is actually really throwing people into a scenario in an immersive setting, like a team building exercise or a dilemma, and they don't know what to expect, and they're immersed in the situation and need to figure out what to do, who's the team leader, what the roles are, etc. And then in situ simulation is what I mentioned earlier, where in a hospital setting or in a school setting, you could actually do a simulation in the place that it would mean the most, like a patient unit, an NICU, the lobby of a hospital, in the parking lot. The in situ really means in that place. Mobile, where you're taking a van and putting a simulator and a faculty member in it and going out and doing simulation. This is very popular. It can be very expensive, but we're really encouraging folks in urban areas to take their learnings and their educators and move to the rural areas where they may not have the funding to do simulation. And then virtual reality, which is really starting to come into fashion, and this is, I happen to be in Riverside County recently, and their simulation center at California Baptist actually has one room, and it's called The Cave. and it's just a black room, and it has lighting, it has sound, it has smells. They can set it up as whatever they want. A battlefield, they set it up as India, where they actually brought dogs in, they had trash on the floors, they had people there, they had simulators, they had food, and it was really about caring for the underserved in an area that really looked like where they were going to go to help these folks. And so it was very high fidelity in a virtual reality setting. So it really isn't about the technology, even though I've described many types of technology. It's about the methodology and really having standards, templates, and agreement on how you're going to run these simulations. And I think part of our program really focuses on just that, and looking at the evidence to say what goes into building a scenario, how do you debrief, what is the time that you should take to do that, to conduct a debriefing and a simulation. And that is what I think the industry is focused on right now, is really the methodology going forward. So I'm going to turn it over to Genevieve right now to talk a little bit about running a simulation lab from her perspective, and then I'll come back and wrap up. So Genevieve, take it away.
Thank you, KT. Hello, my name is Genevieve Charbonneau, and I'm currently the Simulation Center Manager at the University of San Francisco School of Nursing. And prior to this, I was also a Simulation Center Manager at Kaiser Permanente in Walnut Creek. So, what does it take to run a sim lab? As KT had mentioned earlier with regards to the 4 objectives, the purpose, what's the purpose of running a simulation lab? The goal of running a simulation lab is to empower nursing students with resources to enhance clinical skills and also improve critical reasoning through interactive simulation training. A successful program provides hands-on learning using a high-fidelity simulation mannequin, also in combination with a didactic presentation based on evidence-based research. This program is used for BSN students, as well as the clinical nurse leader programs and unit-specific training for all inpatient students and units. Next. So what are the day-to-day operations of running a simulation lab? The USF School of Nursing and Health Profession retains the Simulation Center as approximately 25% of a nursing student's education. At the Simulation Center, instructors, lab managers, lab directors, and of course, sim staff technicians work together to produce realistic patient scenarios that test nursing students' knowledge of medical procedures, patient care, and overall patient physiology. The responsibilities of managing a sim lab are basically to provide direct support for nursing instructors as well as nursing students, and they do this by utilizing modern patient filing and simulation software to manipulate patient physiology, procedures, and storyboards. At USF, or University of San Francisco, the sophomore twos, for example, use simulation for clinical classes, practice, testing, as well as simulations. The junior twos and senior ones come to the sim lab for all the same reasons that the sophomore twos come, but they're a little bit more experienced, and now they're being introduced to clinical orientation, skill acquisition, and simulation. The lab is staffed Monday through Friday from 7:30 a.m. to 5 p.m. And the lab has a staff comprised of really some choice senior nursing students, as well as non-clinicians who are simulation technicians. The full-time staff includes a simulation director and a simulation manager. Next. I'd like to invite your attention to the layout of our USF's simulation lab center. And like Katie had mentioned with regards to the standardized patient and participant, we're interchanging simulation center as well as simulation lab here. The University of San Francisco School of Nursing campus presently has almost 800 undergrad nursing students. There are over 400 graduate nursing students. At the Simulation Center at USF, we have 4 conference rooms, 1 control room, and 4 surrounding patient rooms. These students come through our simulation lab on a daily basis. In retrospect, we need to also always look at equipment. And as Katie had mentioned, now that we have this layout and we have the equipment set in place, there are some things that I would do differently. And I'd like to point it out later, but kind of touch base on it now. And that's making sure all equipment is mobilized and on wheels. And I'm going to talk about the lay of the land and how to lay out a lab and flipping rooms. But before we do that, let's continue to the next slide, please, and give you more specifics. The 2,000 square foot simulation center has 4 individual hospital rooms, a maternal child ward, a pediatric ward, and of course 2 other multi-bed practice rooms, plus 4 conference rooms for debriefing. There are low, medium, and high fidelity mannequins which are available for teaching and learning. This presents an exciting challenge for the University of San Francisco School of Nursing and Health Simulation Center faculty and staff. Every semester, about 75% of the nursing students use the lab in various capacities. Next. So let's talk about the use of areas. Oftentimes, sim labs have very limited space. So, as I had mentioned earlier, flipping rooms is very common practice. What this means is that a room that was being used, say for example, a med-surg room, could be flipped into a clinical setting by simply rolling out the hospital bed and rolling in an exam table, and voila, you go from a patient hospital room to a clinic within minutes. And as I mentioned earlier, that's looking back, all of our equipment is not on wheels and not mobile, so it is time consuming and can cause a little bit of a conundrum when we need time. Next. Let's discuss inventory. Inventory is another essential aspect of running a sim lab. It's really important to get a grasp of what products are being used the most. Implementing a stocking system is crucial. I'd like to invite your attention for just a moment to the screen. If you look at the before screen, this picture shows our storage room. The cart really holds most of what the sim techs need during a daily scenario. It can hold anything from tegaderms to needles to, if you look to the left, those are legs that for a patient that has edema. And what was happening was, before I came to the sim lab, it was a hodgepodge. And the sim techs were coming in and kind of grabbing what they needed and going back to their patient rooms and filling up their carts. Well, you can only imagine what happened next. There was products missing. And so afterwards, if you look at the picture to your right, you can see we implemented a restocking library, if you will. And it was quite easy. It's very basic. Anybody could do it. You don't have to have a high-tech simulation lab in order to do it. The bottom line is if you don't have a standardized stocking system in place, anyone can go back to the storage room, pull and take products, and it can eventually be disastrous. And this is really important when running a simulation center or lab. Next. So, what are the top 5 things that I would consider when running or managing a sim lab? And I kind of broke it down for you. The first one being that before all else, know your technology and staff. And Katie, she's very right when it comes to methodology. That is your number one thing. But you should make sure that your staff, including not only your sim techs, but your sim instructors as well, are all on board when it comes to what technology you have in your particular simulation center. Simulation labs often require sophisticated recording equipment, specialty mannequins, and the appropriate clinical tools and equipment to create realistic patient care environment. And according to Kaylor Slater, who authored, quote unquote, Designing a Simulation Lab That's Right for You, they state, ultimately, the integration of technology needs to support the teaching preferences of your educators. In other words, identifying and acknowledging these preferences in the early planning stages will greatly improve with the help of not only budgeting, but also managing a sim lab. The number two thing to consider is what level of realism is required. Being as realistic as possible in a simulation setting allows for the nursing students to transition easily into a hospital setting with a minimal learning curve. When managing a lab and incorporating the realism aspect into the sim environment, it's very important to consider the budget as well as the space and also the technology required. Next. The third consideration would be observation room location. What does that mean? Well, some of the most basic simulation labs integrate technology along with methodology and use of specialty mannequins. And most nearly all incorporate cameras and microphones for student observation and documentation. The level of sophistication in monitoring systems may or may not greatly influence instructor and student observation requirements, but this is still essential in running a smooth sim lab. It requires extensive knowledge and also management when these tools are being utilized. The fourth consideration is the importance of debriefing rooms. Another important aspect is also the space. These spaces are equally important to the educational environment as the simulation rooms. They allow for in-depth learning. A space where instructors and students can critique the simulation and review a student's performance is also very crucial. And lastly, being flexible. As our nursing program and nursing student population grows, as Katie had mentioned, here at the University of San Francisco's School of Nursing and Health Professions, the curriculum is expanding. Will there be required national testing, or might a research program be desired? Who knows? Being able to manage a lab requires flexibility for the future. To plan for core support space, which typically can be built for a much lower cost than the simulation environment, allows for the expensive spaces to be used at their maximum capacity. This allows basically for the latest versions to be incorporated into your space. Thank you very much.
Thank you, Jen. So you got a sense of what our sim center looks like, and I can tell you on any given day it is pretty crowded. And I appreciate Jen and her management of that center. And those of you who have signed up and have been accepted to the program will have an opportunity to tour and work in the lab when you make your visit to San Francisco. So let's just move on to debriefing. Now, Jen talked about space for debriefing, and in reading several simulation textbooks and talking to experts over the years, the ideal model for a debriefing room is right next to the high fidelity or simulation room. And the reason for that is that you don't want to break a sense of realism. Once the learners are finished with their sim, they should move right into that debriefing room and sit down and discuss. The evidence shows that this is where the learning occurs. And although they're learning while they're in the room, the actual aha moment or light bulb comes on during debriefing. Also, if you have observers watching a simulation, they can participate in the debriefing and learn just as much as the folks who were touching the simulator. It's usually twice as long time-wise than the simulation, and if simulations are going from 10 to 15 minutes, then the debriefing should be from 20 to 30 minutes. And this model allows us to book and schedule hour blocks for each simulation, because you'll have a pre-briefing, you'll run the sim, and a debriefing, and that should all take place within an hour. It allows time for reflection, and the faculty should be trained in debriefing facilitation, and they should be taught that they should hone their listening skills. The literature shows that faculty talk too much, bottom line, and they need to listen to the students, and it is very hard to sit silently for a minute or two and wait for a student to speak. But it's very different than conducting a post-conference in a hospital clinical setting where you're teaching. This is really about learning. And so they're really learning moments versus teaching moments. And we really pride ourselves in having faculty that are trained in debriefing and focus on allowing the students to self-reflect rather than saying things like, well, you should have remembered that because we talked about that. It was on page 60, da-da-da-da-da. We want them to process it and lift up their learnings together. There are multiple methods for debriefing, and we try to use a combination of all of these. There's the gather, analyze, summarize, which is also known as the GAS model. There's debriefing for meaningful learning, DML. There's the plus delta and debriefing with good judgment, to name a few. And so we, depending on the facilitator and their comfort level, and depending on the scenario and the students, they may use a combination of both. I would say the plus delta is a really good way to sort of end the debriefing by saying, okay, so let's talk about what went well and what areas that you'd like to work on in the future. So space is important for that debriefing, and it needs to be quiet and not noisy in the middle of the hallway. Although some debriefing does take place at the bedside in the in situ environment, it can be possible to debrief in the room, but generally you need to step away from the mannequin. Some resources that I'd like you to take note of are the Society for Simulation in Healthcare, and that's ssih.org. And they have an annual meeting, the International Meeting for Simulation in Healthcare, and it is in San Diego in January, and we have several faculty that will be attending and presenting at that meeting. And we're also going to be having a booth in the vendor area exhibit hall, so that if any of you are interested in our program, you can stop by and talk to us one-on-one. We're also going to have several of our students in the booth. We're graduating our first cohort of students in 2 weeks on the 18th of December, and they are going to be rotating through the booth if you want to pick their brains. They have a peer-reviewed journal through the SSH, and it's you receive that as part of your dues. The other is the International Nursing, actually it's Association for Clinical Simulation and Learning, and ANAXL really focuses on nursing and creating standards around nursing, and their meeting is in June If you're able to join both, I would recommend it. I happen to be a member of both. It's very important to understand what's going on in both worlds. The SSH is very interprofessional, and Axel is more nurse-centric. They also have a peer-reviewed journal, and so you also have access to that as a member of that organization. The Quality and Safety Education for Nursing, which is QSEN, is another resource for you. And at USF, we have incorporated the QSEN competencies and the KSAs into our scenarios. So when we're debriefing our students, we can also point out where in the QSEN competencies that the scenario pointed to, like teamwork and collaboration, patient-centered care, etc. So we've incorporated those into our SIMs. The California Simulation Alliance is an organization based in California. It's a virtual organization, and it has been sustainable for the past 7 years, and their website is californiasimulationalliance.org, and there you can find scenarios that you can download, courses that you can take, and a plethora of resources that you might want to take advantage of. And then this white paper on a sim lab that Jen talked about, here's the reference to that. I believe you can download that PDF. So I'm going to segue now into talking a little bit about our master's degree in healthcare simulation program. This is a 30-unit program which includes a 540-hour practicum. And it is not a clinical practicum, it is not a clinical degree. It is a Master's of Science, and it's more educationally focused. So we have geared our curriculum to be more of a generic curriculum. It's not geared to the clinician. This December, we are graduating 2 non-clinicians that started in the program not knowing anything about simulation. One of them had attended 1 meeting. The other had no knowledge, but she did the research to find out what the opportunities were in simulation, and I'm happy to say that both of them are employed full-time in newly created roles. One is a manager and one is a coordinator in simulation centers in California. They also have skills to be a technician, which I think is really important. We really don't want our faculty learning how to be a technician. We want our faculty to learn how to work with a technician. And if you're a technician, you need to understand what goes into a scenario, how to work with faculty. So we go over all of that in our program. It is an online program where our first cohort that's graduating was a hybrid program. We had them come to San Francisco twice a semester, but we have now converted to an all-online program. And what that means is at the end of the first semester and I think the end of the 3rd semester, we'll have an opportunity for you to come to San Francisco once. And it says per semester. We haven't really ironed that out yet. It may be too much. It may just be twice in the entire program. It's a highly recommended conference that we'll have. It's not required. You're on your own to get to San Francisco. And we'll have a tour of the lab. We'll maybe go through some simulations. We'll have a speaker, and we'll do a synthesis of what we've learned so far. You'll be able to meet your classmates. If you can't attend in person, we have the ability for you to come virtually. We'll set it up so that you can actually experience it even if you're not here. I want to talk a little bit about the practicum. The practicum is, we have between 90 and 135 hours per semester that you're required to do, and they're definitely tied towards some specific objectives like managing a lab, developing curriculum, etc. And those practicum hours can be done in the lab or center in which you work now, if you do, or in somewhere in your town. And so we have relationships with sim centers all over the world. In fact, we just signed an agreement with a sim center in Melbourne, Australia. So if any of you are interested in going over to Australia to get your practicum hours, we have that available for you. We will not pay for you to go to Australia, but we do have a place who is willing to take our students, which is really cool. We want you to be prepared to be a professional simulationist, whether you're a physician, whether you're a nurse, whether you're a non-clinician. We are graduating a physician and a nurse as well this semester. The physician is an emergency department physician who has been doing simulation on the side and wanted to further his education so that he could then become the regional lead in his area to run some simulation programs. You need to have a bachelor's degree minimum with a 3.0 GPA, or a master's, or a doctorate, or a medical doctorate to get into the program. If you have no experience in healthcare or medical terminology, we will require you to take a medical terminology class prior to coming into the program. And there are lots of free ones online just so that you get familiar with the lingo. Because for those of you who are not in healthcare, we speak in a different language and we're very comfortable in that space. And we need you all to understand those acronyms and those terms. So that will be required, and then we have also in the first class a simulation taxonomy where you can look at definitions and terms in the simulation world to get familiar with. Our next group begins in January. The classes start January 25th in an online fashion, and we are accepting applications through the end of the year. We may be able to go into the first part of January to take our last application because we really start communicating with you and getting you up to speed the middle of January. So we have currently about 7 that have been accepted to come in, and we're hoping to have a cohort of at least 10. So we're doing a real push right now to get those last 3. We also are offering scholarships that are available. If you need a scholarship, I would need you to send me an email and we can work that out. And that would be $1,500 per semester for 4 semesters. So it's a good little kickstart to get you motivated. The other exciting news that I have is that we will be launching our simulation certification program as well in January. And the program is designed so that if you take 3 courses in the beginning and a little practicum, you can get a certification as a simulation educator. And then if you take the 3 courses at the end with some practicum, you can get a certification as a simulation manager. So if you take all of those courses, you will end up with your master's degree. But there are some people who just want a certification from a reputable university. So we are responding to those requests, and we're hoping to get some folks in the certification program as well. So as I said, we're going to learn about curriculum development, foundations of simulation, debriefing, evidence-based practice, and research methodologies. You'll learn how to build a business plan, to build a business case, to show what your return on investment would be to open up a program or sustain a program. We're going to go over all the technologies. We're going to go over what the future of simulation holds. And then ultimately, you have a capstone project, which is either designing a curriculum and implementing it, or looking at an existing program and evaluating it. We're very open and flexible to what that capstone will look like. We had from soup to nuts in our last class that we're graduating. One created a curriculum for a simulation technician training program. The other created a program to train all of the faculty in the hospital. If they wanted to do simulation, they have to go through certain courses before they can come in and use the simulation lab. One is creating a regional program, and the other was creating a simulation program for healthcare, Masters of Healthcare Informatics students who know nothing about what it means to be at the bedside. So she created a simulation and worked with them so that they could see what it felt like to be in the room with the patient and trying to chart on the electronic health record. So various different kinds of exciting projects. And we start working with you early on in your first semester to get you going on your project. So in summary, I think this is a wonderful program and it's much needed. And I'm excited about the opportunity come January. We are moving into online. It's new to us. We've been doing that hybrid for a while. So it'll be exciting. We're building out the courses now, so they'll be ready mid-January. And it will also include a synchronous portion so that we will create Zoom meetings or Skype meetings where you'll have some interaction with your colleagues and your faculty member, as well as discussion boards, videos, and short papers that you will have to do throughout the course of the semester. So at this time, I would like to open it up for questions, and if you have the chat function at the very bottom of your dashboard there, you can send Jen some questions, and she can ask Jen and I, and we can respond. So thank you for your time. Jennifer?
I don't see any questions coming through just yet. A chance here.
Okay. Oh, there's a couple people with their hand up. I can see that. So I wonder if they have a question.
Oh, here we go.
Okay.
So one person is asking, what's the timeline for application submission and acceptance?
So if you have applied, I have reviewed all the applications that are in the system now. And you could be admitted with conditions if you don't have all 3 letters of recommendation. So I will be contacting everyone probably by the end of this week if you haven't already been contacted. And if you don't have your 3rd letter, please do that as soon as you can because that's our policy. So I would say by this Friday, everyone will be notified. And if you apply after Friday, we will notify you probably within 5 days because we're getting down to the wire and the holidays are coming, so we want to have a sense of who's coming in before we go away for the holidays.
We have another question that says, how many weeks is each course?
That's a good question. So we're on the semester system here at USF, which means that we have a spring semester, which starts in January, a summer semester, and a fall semester. And the spring and fall semesters are 16 weeks. The summer semester is 12 weeks. Each week is a different module, or I think they're all set up in 2-week modules. So we have 8 modules for a 16-week course.
And then somebody asked if the application process is the same for the certification program.
Yes, it is. I don't think we have created a separate application, so you would have, it's the same application, but you would have to then just indicate that it's for the certification. And this is, hot off the press. So I think if you filled out an application and then sent us an email and said, I filled out an application, but I just want the certification, that would be great. We're planning on updating our website to include the details of the certification program because we do have 2. The one on simulation education will begin in January, and the one on simulation management would begin in the fall.
That's all we have so far. Oh, wait, here we go. One more. About managing a lab, do you require all faculty to submit requests in using the sim lab for the whole semester prior to starting the semester?
Could you say that again?
Sure. It says, it's about managing a lab. Do you require all faculty to submit requests in using the sim lab for the whole semester prior to starting the semester?
I'm just confused in that question. Do I require all faculty?
Yes, it sounds like if you're the manager of a lab, do you make your faculty request to use the lab before the semester starts, or are they able to request it throughout, it sounds like?
Oh, I think that we're flexible on that. We've actually, because I know if you're offering your lab, there's only certain times that you might be able to accept a student. I think that's what they're asking. And we can map that out for the whole semester, or we can have the student and the lab work together to create a schedule.
Right, and this is Genevieve, and I want to just tag on to that, that usually we don't quote unquote loan out the sim lab. I'm not sure if this is answering the question. Usually our sim lab is pretty booked.
But for the practicum, when they move into those hours, I think we just push them to the site and let them work it out. Anything else, Jennifer?
I don't see anything else coming through. Oh, wait, never mind. Here it goes. What is the total cost of the program?
Well, that would be a really good question for a recruiter who isn't on the line, but everything should be on the website, and our tuition is by the unit, so it's going to be approximately, I think, what is our tuition now? That I can't even, maybe 1,100 a unit?
I'm looking right now.
And now if you multiply that by 30 units, so I would say somewhere around 35,000.
Well, I'm going to look that up. But another question
Okay.
is, I'm beginning a new skills and sim lab in a new BSN program with much support from administration. So far, meetings with architects have concluded. Any suggestions, templates, etc.?
Oh yeah. So that's great. That's great news. Jen, can you chime in on that one? And then I will.
Sure. I think the first place to start, and first of all, congratulations, but the first place to start is go to that resource that Katie had mentioned under resources, the reference, the white paper. These two authors authored a how to start up a simulation center or lab, but more importantly, how to manage a lab. They give you excellent resources in this white paper. I just don't know it off the top of my head, but some templates to use. Well, the CSA templates are excellent resource when doing scenarios and when you start meeting with your sim instructors and developing scenarios for your students. And that was also mentioned under resources as well. If you go to any of those resources, they would be, they're filled with tons and tons of templates.
Right. And I think that for me, I would throw in that you probably have a lot of support and you're moving forward, but make sure that you have budget for faculty development, ongoing faculty development. You can have a wonderful policy and procedure manual and all the beautiful simulators and lab in the world, but if you don't have ongoing faculty development, that would not be a good. You need to make sure that's budgeted for.
And then another question, who runs the scenarios in the sim lab? Is it a set faculty, or do you train faculty to run their own groups?
Jen, you want to answer it for USF?
Sure. The way that we do it here at the University of San Francisco is that we have a set group of simulation instructors who are all from the School of Nursing that actually run all of the scenarios. The director, Lisa Sabatini, Dr. Lisa Sabatini, actually sits with all of the instructors, the simulation instructors, prior to the semester starting, and they go through every single scenario with a fine-tooth comb, and they make sure that everybody is on board with regards to what objectives are going to be met, and the availability of the schedules are brought out, and it's a lengthy process initially, but as the semesters go moving forward, it becomes a smoother process, and usually sim instructors stay for a long time.
Thanks, Jen. I think that, we're a little unique at USF in that we have dedicated simulation instructors, and that we have clinical faculty that are different, and theory faculty as well. There are other schools around the country that use their clinical faculty as their simulation faculty. Some have just a couple of dedicated simulation folks in the sim lab, and they do all the sims, and they bring in a content expert to help with the debriefing and the setup. So the way we do it is working for us. We've standardized their educational requirements in terms of competency development, and we're very happy with the way it's working. I think the key is to have them communicate with the theory instructors and the clinical instructors as well. And I think that Genevieve and Lisa do a really good job of facilitating that if there are any issues.
And a follow-up for that, which particular resources did Jen mention? Genevieve, I know you...
That PDF, Jen. Let me go back. Let's see. This one at the bottom, white paper.
And then we have another question. We just opened a new simulation center and are having issues regarding restocking problem. Is there a good example to use to help resolve this problem?
Go ahead, Jen.
Thank you. I think it is. It becomes a big issue initially, but like I mentioned, once you have a systematic approach to it, it all smooths out. But I think the one thing that I could suggest is if you have the budget, invest in a good restocking system. For example, there is a restocking system out there called RD as in David, IF. If you just look that up online, a stocking process will come up specifically for simulation restocking. If you don't have a budget, going and taking an actual manual count of all of your inventory and using an Excel spreadsheet will help. And monitoring, as a simulation center manager, monitoring all of your products and equipment and staying on top of it. I do it every single day. If you're not as busy as we are, once a week would suffice, but definitely part of an operations process.
Thank you. Any other questions, Jennifer?
We have another. With a non-clinician background, what are my possible options or alternatives in educating students in simulation once I get my master's?
Okay. Let's see. So non-clinician background, possible options in educating students in simulation. So there is a lot of opportunity for educating students in team building and collaboration, in delivering bad news, in ethical dilemmas that aren't clinically focused. I think that as a master's prepared healthcare simulationist, you may have more knowledge and experience than some of the simulation faculty. And you would be able to work with them to conduct the simulation as a partnership, and they would be the content expert. So I think that it's really, really wide open. We have actually non-clinicians that are skilled in simulation conducting simulations every day in sim labs around this country. When it gets down to the clinical piece, that's when you pull back and say, I need a content expert to help me with this. And really, we're seeing that simulation is being used more and more for teamwork and collaboration and communication than necessarily the clinical content. So I think there's a huge opportunity for you.
We have one question for a hospital sim lab. What would you recommend the sim tech FTE to be versus the nursing manager who will train faculty and facilitate scenarios? Also planning a small FTE for the medical director.
Well, depending on the size of the hospital and the size of the program, I believe that we all often cut ourselves too short and think that we can get by with a 0.5 FTE. I'm all about having a full-time FTE for a sim tech, because if there's no sim going on, they can do other things like stocking the room, preparing things, setting things up, working with faculty to start to write scenarios, and working with vendors, etc. So I'm all for a full-time sim tech. I think Jen would agree.
Yeah. I would totally agree to that. I think coming from Kaiser and running a simulation center in hospital, it's true, because sometimes they would do ad hoc mock codes, and oftentimes they would need to utilize a sim tech for that. And like KT had mentioned, there's a lot of administrative work as well as restocking that we could use the sim tech for. And not to mention policies and procedures.
Right, policies and videotaping and doing some website or IT stuff. I mean, there's so much that person can do, and I think that the trend nationally is that is a full-time position, that we don't want the nursing or physician faculty to be in that role. We're paying them to teach and facilitate, so we absolutely need a sim tech. We totally support that role. Any other questions?
It seems like that is it. I hope I answered all the questions. And the one about the cost, I'm going to forward that to our recruiter.
Perfect.
And have her get back to you with that answer.
All right. Well, thank you, everyone, for joining us. We did record this, and if you want to revisit it. And the other thing is, if you have any questions at all, contact me, and I'll get you the answers, because remember, we're kind of in a time crunch now because we're getting towards the end of the year. And that was my email right there. It's ktwaxman@usfca.edu. Can't find it now. Thank you, everyone. Have a good day.
Bye.